Hello there. My name is Dr. Abhinandan Punit. I am a consultant orthopedic and robotic joint replacement surgeon at Narayana Health City, Bangalore. Today we are here to talk about arthritis. What is arthritis? Arthritis means inflammation in the joint. So, joint inflammation can happen due to many factors. They are predominantly classified into infective, inflammatory and age related. Infective means the joint gets infected with bacteria or tuberculosis or fungal, leading to arthritis. Second is inflammatory. Inflammatory means swelling secondary to diseases in the blood such as rheumatoid arthritis, seronegative arthritis and ankylosing spondylitis. There are few examples which can cause inflammatory arthropathy. The third one is arthritis due to aging process. So the most common arthritis which one would suffer is age related arthritis, and the most common joints are the knee and hip in Indian subcontinent. So majority of elderly population in India do suffer from osteoarthritis of the knee joint. Now, anybody who is having a joint pain could be suffering from joint arthritis. It could be early stage or a late stage. So, if you have swollen, painful joint, be it in the wrist or your hip, knee, shoulder, any major joints, kindly consult your general practitioner orthopedic doctor for further advice.